My name is Owen Parra. I am a fourth-year medical student here at the University of Pennsylvania. A little bit about me. I am initially from Kansas City, Kansas, not Missouri. So grew up, born and raised Kansas City, Kansas, and that's where my whole family is. So I go back and try to visit a good bit. But I have bounced around quite a bit since then. I went down to New Orleans and was there for undergrad and for some time after that as well. And then I've been here in Philly for almost 4 years now that medical school is kind of reaching the end. So the main global health work that I've done here at Penn, I engaged in the global health clinical elective over in Botswana. And it was a great experience. We got to work directly with other medical students from Botswana, as well as attendings and residents there in providing direct clinical care to patients. And then we also, kind of outside of the hospital, got to learn more about the public health factors that really impact a lot of the health conditions that we were seeing in the hospital. So the clinical rotation in Botswana, there was a few different reasons why I pursued it. One being my interest in global health, and I think that's really paramount. It is something that I'm interested in doing further in my career. So it was important for me to get some early exposure to that as a medical student. But one of the other main reasons that I decided to pursue that opportunity was because it's nice being at a place like Penn where you have access to a lot of different resources and everything's kind of at your fingertips. But the hard part is that there are other places where you might be working, especially in global health contexts, where you might not have all these resources at your fingertips. And I think it's important to know how to practice in those areas. Oftentimes you have to get a lot more creative. Oftentimes you have to be a lot more reliant on things that are not as relied upon here, things like your physical exam or just talking with people, your direct interactions. So I think that is very challenging, and it made it difficult at times to push patient care forward when you are thinking of all the things that you wish you could do, but there's really what you can practically do. I also did a little bit of other global health work too. Predominantly was in my first couple years, I volunteered at the Penn Refugee Clinic, mostly shadowing attending physicians that were taking care of refugees and asylum seekers here in the US, seeing the outpatient appointments that they had with them, and then I also was at times following up directly with patients to help coordinating their care following their appointment, making sure that they got their medications and everything. And then I also worked with the Center for Surgical Health, and that was a little more involved, a little more direct work with a patient, or multiple patients really, where it's typically with undocumented individuals in need of an emergency procedure, and I was helping them get access to things like emergency Medicaid and helping them set up all their appointments and coordinating all their care. So in terms of my interest in global health, it started pretty early. So in undergrad, I was in New Orleans, as I mentioned, and I was initially mostly focused on neuroscience and psychiatry, but it's a city in which the social determinants of health are pretty evident, and it's one where it's hard to ignore them, I will say. And so I got invested in the world of public health in my time during undergrad. I was kind of debating at the time whether I wanted to go into medical school or whether I was thinking of taking more of a public health focus with my career. I took some time to think about it, and I decided on medical school because I really cared about the direct patient interaction and felt like that was the way that I might have the most impact. And when I got to medical school, I already had this interest in public health, and I'd always been fascinated by the idea of pursuing global health. I think it's nice because you have public health, you feel like you can do something more directly in the local environment, but then when you really start to think about it, the issues tend to be much broader than what's directly around us. The global health experiences that I had here were, I think, pretty paramount in what I think I'm going to do with my career. I want to continue pursuing global health. I, again, had the interest coming into medical school, but I think with a lot of things in medical school, you never really know until you have an opportunity to try things if it's going to be something that you like in theory or if you actually like it in practice. The global health experiences that I did really reaffirmed that this was what I wanted to continue to do. It's very tough because I think a lot of personalities in medicine, we are type A in a lot of ways. We like things how we like things. We're very organized. That's how we got this far. But I think with any type of medicine, At some point, you have to keep that for your organizational skills, but you have to be willing to let that go a little bit and be a little more flexible. That's true in a lot of different rotations, but I would say on a global health rotation, that is especially important. Things will go wrong. Things are going to be frustrating, and you're going to have to learn how to adapt pretty quickly. You'll get some of that on your other rotations, but again, you'll get a lot of that in this situation. So I'd say that's one piece of advice that that I would have, is just to keep a very open mind when you get there and just be really ready to go with the flow.